Welcome back to this edition of Wealth on Health. The search for a cure for Parkinson's disease has heated up recently as advancements are made in stem cell research. The Stem Cell Global Foundation has been a forerunner in making stem cell solutions accessible to patients in need. They work closely with stem cell therapy centers like the Integra Medical Center in Mexico, where an innovative stem cell treatment has helped Parkinson's patients see major improvement in their symptoms. Stem cells are an important part of the human body. They help make up who we are.
It's very easy to think of stem cells in the following way. Very shortly after fertilization, you start having cells which are incredibly plastic, incredibly malleable. They simply don't yet know exactly what their address is meant to be. Are they going to give rise to the brain, or to the heart, or to the bone marrow, to the skin?
The great potential of stem cells as a cure is very evident in our world today. Nevertheless, the opinions vary on just how promising they really are.
We've got stem cell coming up, and stem cell should be something that will be incredibly valuable to our community. You know, 20 years ago, when we were just getting this started, we weren't calling it stem cell, we were calling it fetal tissue transplant. And I'm so happy that 20 years later, we're not only calling it stem cell, but we also are at a point where we don't really need to use embryos. Our science has gone so far beyond that, what we can produce our own stem cells from a person's own body.
I think stem cells has its place. I think it's extremely overrated. It's a cure for everything. It's a snake oil of the 2000 years with it. It certainly needs a scientific research to go with it and to prove what it can do and cannot do.
Stem cells are really in the media at the present time. Everybody's talking about them, and there have been several clinical trials on embryonic stem cells that have already been done. Unfortunately, in those two trials, there hasn't been a good, robust response, and there's been a lot of difficulty, such as major involuntary, uncontrollable movements.
While clinical trials in the U.S. are still in the early stages, it appears a cure might be just around the corner in Mexico. That's where Dr. Omar Gonzalez founded the Integra Medical Center and has changed patients' lives with a revolutionary procedure known as placenta stem cell therapy.
It involves a subcutaneous implantation of this tissue that's specially prepared and with a guaranteed sterility, that everything is clear. It has to be tested for everything. And after it's tested, it's processed and then prepared for implantation in special vials. And then it's placed in the method that I developed is to customize it according to the patient's condition.
Dr. Gonzalez recently treated Parkinson's patient Jeanette Montufar. Her situation was bleak.
Well, she's a patient from New York, and she came depressed, without the sense of a bright future for her.
I came to Dr. Gonzalez initially with shaking in my hands, a very drawn face, and aches and pains in my shoulders and my back and my leg.
So she came with the symptoms, which is in early or moderate stages of Parkinson's disease. And so I worked on her, for her with this method, and when I saw her 6 months after, she wasn't like another person, you know. She was thinner, happier, smiling with that bright future ahead of her.
I have rejuvenated. People, friends and family say, wow, you look younger than anybody else I know, and it's because of him. My tremors have subsided, my aches are gone, and my face has totally changed. They say I radiate, I'm glowing.
How old are you?
Parkinson's patient David Muir also recently received placenta stem cell therapy. Even just moments after the surgery, David was already noticing improvement in his symptoms.
I feel real good, painless. I hope to see you again.
Yes, we just did the implants. We did a couple of implants back here, and I did a couple of implants in the lower abdomen. Show me your hands movement. Okay. All right, all right. Now move your hands up and down. Very good, very good. Hopefully they are more like relaxed, isn't it? Like less rigid.
Yeah.
And a little bit in coordination is a little bit better. What do you think about your coordination in your hands?
Much better.
His main complaint was the lack of coordination and rigidity. And he improved substantially in those areas.
Thanks to his innovative therapy, Dr. Gonzalez has drastically improved the life of his patients.
You know, that's my mission, to help people and pioneer techniques and people, you know, techniques that are not out there, you know, to try to be creative and try to be innovative in the methods that I would do. If you have the result with the patient and the feedback, the positive feedback from the patient is like the best. You know, you have this sensation of fulfillment and accomplishment.
As you have just seen, there is significant progress being made to treat Parkinson's disease. And now with treatments like stem cell therapy being explored, the future for Parkinson's patients has never looked so promising. Thank you for tuning in to this edition of Wealth on Health. I'm Jordan Bettinger, and we'll see you next time.